for being in attendance today, and I want to thank our colleagues in public health lab and the academic setting for joining us this evening. We have been saying it's not a matter of if, but when that we would find Omicron in our state, and that when is today. We have been preparing for this moment. Today, the Washington State Department of Health is announcing 3 different cases of Omicron in 3 different counties of Washington: King, Pierce, and Thurston. Washington becomes the 13th state across the nation to confirm Omicron within its borders, and as you know, it has been found in at least 38 countries. Most of the cases in the United States have some travel associated with them. While there is a lot we are still investigating, here is what we do know. The genotyping results came back, were confirmed midday today. We know that the individuals whose results came back today range in the age from 29 to 39, 2 males and 1 female. We found these results due to our increased genotyping efforts here in our state. As you heard us say earlier in this week, that was a key driver for what we were going to be doing as we continue to watch and monitor for Omicron in our state. Dr. Lindquist and others will touch more on this shortly. Here's what we do not know. We do not know yet information on severity of disease or hospitalization at this time. We also do not know the travel history for these individuals as of yet. That, as well as vaccination status, are key details that we expect to learn more as we continue our investigation efforts in the coming days. So it is early, but we felt we should share as early as possible with you, the media, and our community. When we do know more, we will certainly update and share with you. As we've been saying this entire week, Omicron is a reason for concern. However, it is not a reason to panic. Washington was primed to find it quickly, our state as a whole and all of our partners together, and that's what we did. Omicron is highly mutated, but as we know, Delta variant remains the dominant variant in the state of Washington. It remains to be seen if that will continue or change, or how so in the near future. The next few weeks will be critical in determining how this variant spreads compared to Delta. We absolutely continue to monitor that as well as continue in our investigation. As you know, we have been emphasizing throughout the tools to fight COVID-19, whether Omicron, Delta, or any other variant. The best ways to prevent the spread of this new variant or any other variant is, of course, to get vaccinated. And that's for both adults and pediatric children. That's for primary vaccination for those who have not gotten vaccinated yet, as well as boosters for those eligible. And we certainly want to continue to emphasize wearing masks and other safety protocols, especially indoor public settings or in crowded situations. That is especially the case as people travel and also the holidays right around the corner. As a state, we need to do what we're doing, but we also need to rely on our community to do what it can do to help us fight this COVID-19 pandemic as we continue to see it unfold within our state. And let me close by saying this is a moment that all of us have realized since the CDC provided information here in the United States and our global partners provided information on what was happening in Africa and beyond. And I think it underscores the key message that we may be tired of this virus, but as Omicron and our current surge of Delta in our state show, this virus is certainly not tired of us. So I think it's absolutely critical for us to continue our efforts. And with that, Julie, I'm going to turn it over to Dr. Lindquist.
Okay, thank you, Dr. Shaw. And as we've been saying this week, we were highly confident that we were going to be able to detect this variant in Washington very quickly. And it has turned out that Washington is ready for this. We've been prepared, and our preparedness efforts really have allowed us to find these cases we're talking about today. One of those, and we'll hear from Dr. Baird a little later from the University of Washington labs, is really working with our lab partners and our public health lab to increase our surveillance for a certain part of the test called the S dropouts for those that are doing those, to get a quick screen to see if it could be Omicron, and then getting these genotype very quickly. And I'm just amazed at how fast the University of Washington did this, and we'll talk about this a little later, but that's what allowed us to detect this so quickly, is an increase in our surveillance efforts. And the other very important part of this is prioritizing cases. And when we get these cases, that we investigate them and we find out who the contacts are. We call that case investigation and contact tracing. And these are some of the highest risk folks that we know, those that have traveled from countries where Omicron is present, in these labs where there's S dropout, and anyone who's been identified as a close contact to Omicron case. These are really where our efforts are going to be right now. So for the public, it really means when the public health department calls, answer your phone. It is critical for us to get to the tools that we know that work, such as isolation or quarantine, to help us limit the spread of this. I don't think any of us feel that we're going to stop the spread of this. This is clearly already here, but these are things we can do to limit the spread. And with that, I turn it back to you, Julie.
Thank you, Dr. Lindquist. Now we go to Dr. Duchen, Health Officer for Seattle, King County. Go ahead.
Thank you. I just want to start by acknowledging that this is stressful news that no one wants to hear. And after the long and difficult ordeal we've already had with COVID-19 and the encouraging recent signs of improvement, now during the holiday season of all times, COVID-19 has thrown another nasty curveball at us. But this ball has not reached the plate yet, and we don't know if this scary looking pitch will be a ball or a strike. What I mean by that is, it's still very early in the emergence of Omicron, and right now we don't have solid answers to our most important questions: how easily the virus spreads, whether it causes more or less severe illness, and how effective existing COVID-19 vaccines and treatments are against Omicron. But we do know enough to be concerned. Preliminary information suggests this virus may spread even more readily than the Delta variant. In addition, preliminary data suggest people who've had COVID-19 in the past are more likely to be reinfected with Omicron. On the other hand, preliminary evidence also suggests that there may be fewer severe cases occurring than would be expected in South Africa, where the outbreak was recognized. Now, all of this is very preliminary data. I hope I'm wrong, but I expect we'll see many more cases in the coming weeks. Exactly how many and how severe they will be is less clear. Again, none of this is known with certainty, but there's a lot we can do to protect ourselves and our community. But it's possible we may see a rapid and potentially large surge in cases, with most infections and most serious infections expected among the unvaccinated. And although we know that even vaccinated people can be infected, while we don't yet know how well our current vaccines will protect against Omicron, I think there's a good chance they'll offer meaningful protection. For that reason, I believe our relatively high vaccination coverage will help blunt the impact of a potential Omicron surge, should it materialize. In this context, both getting vaccinated and getting a booster when you're eligible is especially important. Omicron will likely pose at least some new challenges that we'll need to respond to. But compared to the early days of the pandemic, we know much more about COVID-19 and we're better prepared for it. Even with a highly mutated virus like Omicron, we're not going back to square one of this pandemic. So what should we do now? Wherever there is room for improvement in how we're using our current tools and strategies, this is a good time to make those improvements, especially getting vaccinated and booster doses when eligible, wearing high quality and well-fitting face masks or respirators, improving indoor ventilation and air quality, and avoiding crowded indoor spaces and using distancing. And finally, we know layered protections, meaning vaccine plus precautions, work best together to maximally reduce risk. And that will continue to be the case for both Delta and for Omicron if that does become a dominant strain circulating in our community. Thank you, and I'll turn it back over to the moderator.
Thank you, Dr. Duchen. We have several emailed questions, and we will begin with one from Debbie at the News Tribune.
Julie?
Dr. Shaw, would you like to add something?
Yeah, Julie, before you do that, Dr. Baird is on with our colleagues at University of Washington Virology Lab. And I thought before we jump in, Dr. Baird, just first of all, gratitude to you all for just the incredible work in very quickly identifying this genotyping in our state. I thought maybe if we could, before we go to Q&A, just turn it over to you if you wanted to make a couple of comments that might be of importance on both the genotyping side, but just what you all have been thinking about when it comes to having that rapid elucidation of what's going on.
Thank you, Dr. Shaw. Yes. In the UW Medicine Virology Laboratory, we've been sequencing hundreds of positive samples per day, mostly using standard genomic sequencing technology for doing whole viral genome sequencing. But as you've heard, we mentioned, Dr. Lindquist mentioned things like S dropouts. There are rapid PCR-based screening methods that we can use to find certain variants within hours and not days. And so as we've been screening our samples, we got 3 presumptive results late yesterday, and then moved actually to whole viral sequencing, genome sequencing overnight, and had those results today. So we really have the ability to do many hundreds of these, or over 1,000 a week of these, and we have been scaling our operation within partnership with your group, with the state of Washington, and with our colleagues in public health to meet the needs of the state here, so that we actually do have the capacity to identify these things just as fast as they come. So we had been waiting for it, just like you had said. We thought it was inevitable, and we have been waiting. And if it wasn't today, it would be tomorrow. We're pretty sure. But this has been really the product of over a year and a half now of investment and building our resources and new workflows, so that we can do this very quickly. And with that, I'll turn it over to the moderator. Thank you.
Thank you very much. So we do have a few questions that are starting to come in, and we begin with one from Debbie at the News Tribune that I will ask on her behalf because of some audio glitches. She begins with, what is the vaccination status of these individuals, and have they now all been reached since the release was sent?
Yeah, thank you, Debbie, for that. And I'll turn that over to Dr. Lindquist and Lacey Fehrenbach as well. At this point, we're still in the midst of the investigation, so we do not know the vaccination status for the 3 individuals at this point. But that I expect will change as we continue our investigation over the coming days. There's a lot of information that all of us want to know, and certainly we are going to do everything we can as quickly as we can to find that information. Dr. Lindquist or Lacey, anything you all want to add?
The only thing I'd add is, if I was a patient, I would want to know that I had this variant. But to be very clear to everyone, what we're asking, if you are a person who is ill, is to isolate yourself and not expose additional people. Don't go to work, don't go to school, and to help public health with your contacts. So we know who your contacts are, so we can get them in a safe space so they don't infect others if they become symptomatic and test positive, and then making sure everyone has access to testing and anything that's needed for isolation and quarantine. So, and again, as Dr. Shaw said, we are so early in this investigation. We wanted to make sure that the public knew that we had found this variant long before we got all the details that we all want to know. So hold tight. We will certainly share those as we learn them. Lacey, is there anything else that we should add? Great.
And one of the reasons that we have the 3 county local health jurisdictions here one, show that we're all in this together, but number 2 is that this is a partnership with our state and local, and in fact we've been in touch also with our federal partners as well. So I don't know if either Dr. Duchen or Shelley or Nigel, anything that you want to add as we continue the investigation efforts?
All right. If there's nothing else to add, Debbie had a second question that was for Nigel. Is Pierce County planning any expanded vaccine drives beyond the distribution happening now?
Yes, thanks for the question. Yeah, we continue to offer COVID-19 vaccines every day, and we actually have capacity that's available on a walk-in basis at locations in Pierce County. We've seen some increase in demand for boosters recently, which is encouraging. So it's very important to get the message out that the vaccine is available. Of course, we will continue to monitor the demand and make sure we add capacity to meet the need that's out there so people can get the vaccine. It's so important right now to protect their health and the health of the community.
Thank you. Our next question comes from Matt at Fox 13. Go ahead. Matt, are you able to unmute yourself? All right, I'll work on that tech with Matt. We will check in now with, stand by, Mo from Como. Mo, we can't hear you. There we go.
Is this better?
Yes, we've got you now. Right. Thank you.
All right. Thank you so much for doing this, guys. My question is, when testing is being conducted for this, can you walk us through the process and what exactly is being looked at in order to detect the Omicron variant?
I think I can take that. So when samples come into the virology laboratories, really all across the state, we generally do a PCR test, an RT-PCR test, where we amplify bits of the genome of the virus. And the way that we do that is that we use small pieces of DNA that stick to pieces of the genome, bracketing small fragments of it. But some of the variants, such as Omicron, but also interestingly Alpha, have a small mutation where they're actually missing a tiny fragment of the COVID virus's genome, and that anchor can't stick to it. So we actually miss, and we cannot amplify part of the genome, but we can amplify other parts of the genome. So what we'll see is an aberrant loss of one gene. That gene has the name S, and we refer to that as an S dropout. And so that's a screening test that we can do rather quickly. That just takes a matter of hours to do. So what we've been doing is after we confirm that a case is positive, we will then run it through an assay where we can look to see, has it lost that S? Does it have an S dropout? For these cases, we did yet another confirmatory PCR test just to be absolutely sure that this was in fact missing the S signal there. The S had that S deletion because sometimes these S deletions can occur and not be an Omicron. And then what we also do after that, and this is what we did last night, was we did whole genome sequencing of the virus. And the way that one does that is one does multiple reads. The best metaphor for that would be like if you wanted to look at the contents of a book. What we do is we read a bunch of sentences and paragraphs just randomly from the book, and then we paste them back together to reconstruct the whole book. And so that's what we do with the genome that allows us to then look at all of the different parts of the genome, not just that one little target where the S dropout is, but for these cases and all cases that we identify, we actually have the entire genome of the virus, which allows us to not only call it Omicron, but then also allows us to say, are there additional mutations that we can use to tag one specific case and compare it to another case to see if there has been any mutation or evolution between any two particular cases.
Thank you. Matt sent me his questions, and they start with the advice we're hearing is to get vaccinated. With this announcement of Omicron's arrival, is Washington prepared for a run on vaccines? What does supply look like right now?
Yeah, thanks for that question. I'm going to turn that over to Lacey. This was covered both at our DOH briefing on Wednesday as well as the press conference with the governor on Thursday. We have both made requests for additional vaccine. We also know that a reminder that a booster is not the same as when somebody is going for primary vaccination when they have a zero immunity. It really is waning immunity from primary vaccination. So it's not that all of a sudden you, as we say, fall off a cliff in terms of your immunity. It's a dial starting to dial down. And so we want to make sure that we do have adequate capacity for vaccinations in our state. And that's a little tight, but we do expect that to open up. Lacey?
Demand has already increased with the announcement of Omicron globally last weekend and the change in guidance from the CDC on Monday recommending that all adults 18 and older get a booster. We have seen, increased traffic on our vaccine locator website and also to our call center. I did want to note our state has been approved to receive 70,000 additional doses of Moderna vaccine next week. So those are ordered this week for delivery next week to help meet the increased demand. Also, just some reminders that appointments are tight in some parts of the state, and if you schedule multiple appointments, please go back and cancel any appointments that you don't need. We do want you to get an appointment, but if you have scheduled multiple, cancel the other ones that are farther out. And the other quick reminder is that these vaccines are safe and effective, and take the one that's available to you, as opposed to shopping around for a particular one.
Thank you. Matt's follow-up was, for those who are still too young to be vaccinated, is there any added concern with the speed of spread regarding Omicron?
Yeah, and Dr. Quanget is also here, and as a pediatrician, I think it might be, I know Dr. Lindquist is as well. Either of you, let me turn it to one of you if you want to take that.
Yeah, that's an excellent question. I think for those who are too young to get vaccinated, it's a cause for concern, but not a cause for panic. I think as Dr. Duchen mentioned, we have all the familiar tools we use against COVID-19, and we just need to keep on doing those more and better. So for our kids who are too young to get vaccinated, they should continue to wear masks in indoor public spaces, wear masks if they're in crowded outdoor spaces where a lot of people with unknown vaccination status. And if you have a child who's sick, then keep them at home. And if they have symptoms of possible COVID-19, talk to your healthcare provider about getting tested. Probably the best tool to protect those too young to get vaccinated is to get everybody else in the family vaccinated. Because the more protected everybody else in the family is against COVID-19, the less likely they are to transmit it to those who are too young to get vaccinated. And I think this is also really true, especially true for those with chronic conditions. So it's especially important for children aged 5 and older and adults with certain chronic conditions who place them at high risk for more severe disease against COVID-19, for hospitalization and death, to get vaccinated. For those who are 5 to 17 to start their vaccines, if they haven't already. For those who are 12 and older to start the primary vaccine if they haven't already. For those adults who maybe haven't gotten vaccinated, and now's the time to do it. Don't wait for a future vaccine version to come out. Do it now. And if you haven't gotten your booster, to do that. Again, especially if you have chronic conditions that place you at higher risk for severe disease from COVID-19.
Thank you, Tal. Just one quick clarification. There were 3 individuals, 2 in their late 20s and 1 in late 30s. So just to clarify the age range, there was a question about that in the chat, so we wanted to make sure that was clear. Go ahead, Julie.
Thank you very much, Dr. Shaw. Dominic from the Seattle Times asks, any suggestion that a renewed lockdown may be needed, or is it too early for that?
Well, thanks for that question. I think the first is that we do not have any of those restrictions or lockdowns currently. And so I think it's really important for us to keep that in mind. There is this persistent message or rumor out there that there are lockdowns in place and there are not. What we want to do is do everything we can to have safety protocols in place so people can go about their business and going through their activities, whether it's going to a restaurant or going somewhere, with other community members, a family friend to shop or what have you, but to do so safely, right? And to do that means, one, to get vaccinated, but two, it also means to wear a mask and make sure that we have, as Dr. Duchen mentioned, that it's the right kind of mask. It's being appropriately worn, that it's tightly fitting, and it's protecting you. And then certainly making sure that we're doing whatever we can, especially in crowded situations. That's where I think the biggest concern that we have is crowded situations, indoors or outdoors. And certainly the concern is more of an indoor variety than it is outdoors, but crowded situations regardless are of concern. So we do, I want to make sure to clarify that piece before answering, which is that right now we do not have any plans for anything more than that. Obviously, everything is really about what we're learning about new variants and other information. We can never say never, but at the same time, there are no plans for that. And certainly we want to do everything we can to encourage people to protect themselves and protect their communities around them. And so really that's the key message. And I think the other thing that Dr. Kwan-Get made very much clear, as did Dr. Duchen, is the importance of testing when people have symptoms. When you are with symptoms, we want to make sure you absolutely are getting tested. And certainly if you've been exposed to somebody with COVID-19, but certainly if you have symptoms, and that's a key message as well.
Thank you. Dominic's second question was, when will we have clarity on this mutation's severity and the vaccine efficacy against it?
Dr. Lindquist or Dr. Baird, I don't know if the two of you may have that answer.
Yeah, I think, these studies are going on right now. There's a couple of questions that we're trying to get answered. Will the antiviral medications work? Will vaccines work? How serious are the infections in someone who hasn't been previously infected? All these are going to take weeks. So we're not going to get answers in 24 hours. Some of these may come up in the next week, but we're talking about longer term. And certainly, as we collect experience with these 3 cases in Washington, we'll be able to report back on what we're seeing locally. So weeks, not days.
And I would just point out, in addition, that the preliminary data that is coming out, there was a preprint tweeted out by a South African group yesterday. We should really consider all of that very preliminary. Much of that is based on mathematical modeling and analyses. And we really do need to wait for the analyses that Dr. Lindquist is talking about, which, yes, will definitely take weeks.
And Dr. Duchen, I think you may have something to add as well.
Yeah, thanks. I would just add that the first data we're going to get are laboratory studies looking at what are called neutralizing antibodies. You'll see a lot of reports about this. And we expect that, there'll be the neutralizing antibody titers will take a hit with this virus based on the number of mutations it has. But don't jump to conclusions about what that means for protection. There's a lot more to the immune system than neutralizing antibodies. So just want to throw that out there. We'll get some lab data, but the real important data that we need takes longer to get, and that is how well this vaccine works in actual populations who've been vaccinated before.
Thank you. Our next question comes from Rania at KXLY. Go ahead.
Do you suspect that as we move into the week ahead, there are going to be a lot more cases coming back as positive for Omicron, with just the 3 that came back this past week?
Rania, I'll take that and then I'll open it up to colleagues. I would say, yes, we do expect that we're going to have more cases. This is exactly the message that we had even as we started to see things unfold globally. I think our first message was, do not be surprised if we start to see cases in the United States. And our second message was, do not be surprised if you start to see cases or confirmations in the state of Washington. And just the corollary addition to that is, do not be surprised if we see additional positives. Now, whether they're related to these three individuals, that's a different matter. But in terms of expecting that we're going to see positives, once you start to see, unless it's a very clear, specific instance where you know it's a travel associated and you can somehow cordon off and not have any further spread, at this point, the likelihood is that we are going to see more confirmations. But I think we have to also balance that with remembering that our biggest concern right now is Delta variant in our state. That is right now impacting people as we speak with severe disease, and we want to make sure that we're doing everything we can to protect against that most urgently. So with that, I'll stop if anyone else has any comment.
Well, Umair, I would just add that I think you're right. I think we will see more cases, and again, with so much uncertainty, it's hard to predict how many or how fast they're going to come. But if we look at what's happening in South Africa, there is a potential for cases to come really fast. The epidemics they're seeing are rising more quickly than the Delta surge rose. So I think where we're really vulnerable are our unvaccinated communities. This is where cases can spread exceptionally fast, where we'll see not only more transmission, more disease, but also probably the burden of severe illness will be in unvaccinated people. So the best thing we can do to protect ourselves, given this uncertainty, it will protect us against Delta or other viruses in the future, is to get vaccinated and get boosted if you're eligible.
Thank you very much. We have two more reporter questions before we wrap. The next is Bradley from KHQ. Go ahead.
Hi, guys. My quick question for everyone. I'm hearing a lot of conversation about what's going on testing-wise to be prepared for this over in the Seattle region. What's being done in Eastern Washington to screen for this, and how are those resources from Seattle being used over here, if they're being used by way of the University of Washington, or if there's different relations over here for that pre-screening?
Scott or Dr. Baird?
Yeah, so Bradley, great question, but I'm glad you brought it up, because actually the whole genotyping effort in Washington State is a statewide effort. Not only is the University of Washington one of the labs that is doing genotyping for the state effort, the State Public Health Lab and a handful of other labs are doing this. And part of our genotyping protocol that we set up to be able to find variants like Omicron involve representative sampling from the entire state. So we are getting a fair number of isolates from Eastern Washington. Not to mention, the University of Washington is a statewide system that also is testing from all over the state, north, south, east, and west. So I am really confident that we're getting good sampling and technology on the eastern side of the state as we are on the western side. It's been a big focus for most of us.
Yes, and I would just add that we have multiple community sites set up across the state, as far east as Walla Walla and in the Tri-City areas, for example, in Benton, Franklin County. And we've been doing a lot of community testing in those areas, and we're seeing all of those. So we're sampling a great deal, a swath of the country too. We are not, as Dr. Lindquist said, many laboratories are participating in this, including the state's laboratory. So we're not doing every single last test, but we're always willing to if any health system or any group wants to reach out, we're always willing to do more.
So the bottom line is we've really got Eastern Washington covered, Bradley. Thanks for asking, though, but we got it.
Our final question comes from Kate at KUOW. She asks, what's your advice for people with kids under 2 who can't wear masks and can't be vaccinated? Would you recommend people essentially go back to quarantining at home?
Well, I think our advice is the same that we've had throughout, this pandemic, regardless of today's news about Omicron, which is really the safety measures, not just for yourself, but also your entire family, including your kids. And so I don't think that we are today suggesting that has changed. But what we are suggesting, and we are actually encouraging, urging, in requesting is that people really remember that this pandemic is not over and we still have work to do to get people vaccinated. Obviously, kids under a certain age are not eligible for vaccines, but we do want to do everything we can to make sure that we can protect those children, which is another reason why we need to get vaccinated as adults and any child that is eligible for vaccine. And certainly this also applies to schools, right? We want to do everything we can to keep our kids in person in school, but to do so safely. So there's just a lot that goes into that. I don't think today's announcement changes any of those recommendations, but what it does do is underscores the absolute critical importance of the work ahead for all of us if you've already gotten your vaccine, thank you. And if you've gotten your booster, or thank you. If you have not gotten your vaccination, please get it. If you have not gotten your booster and you're eligible, please get it. If your children have been vaccinated, please get them vaccinated. And then if you have done all those, check the boxes of you've been vaccinated, you've been boosted, your kids are vaccinated, then go get someone, a neighbor, a friend, a family member, somebody who is not vaccinated, and take them with you to an appointment, make an appointment for them and get them vaccinated. I will tell you, I've done that. My team knows there's somebody that I knew this last week that I'd been working on for several weeks. And he was concerned about vaccines. And after several weeks, I finally was able to convince him enough by making the appointment for him, and he is now at least on the road to vaccination. And so again, this is something that is very much a all of us effort. We want to make sure we do everything we can as a state to encourage our family and friends to also get vaccinated. Anything else from our docs, our pediatrician, Dr. Quanget? I saw your hand just came up, so I'll turn it to you.
Yeah, that's really an excellent question. Yes, I agree with everything that Dr. Shah said. And I think we're very fortunate that for the vast majority of children, including those under 2, COVID-19 is not a severe illness. It can be. In our state, there have been maybe more than a dozen deaths in children and teens. But of course, that is much lower than the thousands of deaths that we've seen in adults. So we don't have any indication that Omicron is different from Delta in this way. But of course, that's one of the things that we're going to need to be watching carefully. Are there differences in the severity of the disease that Omicron causes compared to Delta with kids and adults? So right now we don't have any evidence that that's the case. And as folks have said, that Delta is the dominant strain circulating in our communities. So I don't think this is a situation where if you have a child under 2 that you need to go back to quarantining at home. I think you can still enjoy the holiday activities. But it is a situation where perhaps you have a child under 2 with chronic conditions. You may want to take special care and perhaps talk to your primary care provider if whether the particular chronic conditions that your child has warrant maybe more conservative, more protective measures than what you might take for children without chronic conditions.
Thank you very much, Dr. Quanget. Dr. Shah, is there anything you'd like to say to conclude this briefing?
Yeah, I do. But before I do that, round robin, anything that any of our colleagues, anybody wants to say before we conclude? Want to open one last?
Umair, I would just extend my thanks to everyone in the state who's come forth and gotten vaccinated, to everyone who's been boosted. You've done a tremendous service, not only to yourself, your family, your friends, your coworkers, but to our entire community. Thank you. Keep up the good work. This is building a wall of protection for us against the current Delta and against future variants. And I also want to join the thanks to Dr. Baird and our colleagues at UW Virology.
Thanks, Jeff. Thank you for saying that and spot on. Any other closing comments from anyone?
I'd also just really like to acknowledge and thank the team in the UW Virology Lab who have been putting in tireless efforts for weeks, months, now years of working on this. It's really been impressive. So I'm thankful for that. Thank you.
Yeah, I was going to add that same sentiment. We in Washington State identified the first case of COVID in the United States almost 2 years ago now. And since that, one of our strongest laboratory partners has been the UW virology labs. And from COVID testing to lack of supplies to sharing resources, and now to this high level of genetic testing, my hat's off to the University of Washington.
Well, I couldn't have said it better. The two Jeffs and one Scott who just said that. So thank you, and really do appreciate the efforts of all the people and the teams that are represented on this call now. And to Dr. Duchen's comment, and absolutely gratitude and thank you to our community members. We could not be where we are as a state, as a community, unless or without all of those individuals that have worked together and done just such an amazing job. This variant today, this news reminds us that though our work is still not done and we still have work to do. And so we would just continue to encourage people to get vaccinated themselves, for their kids, and certainly get boosted. And most importantly, in addition to masking and making sure that you keep your distance and all the things that we've talked about during this briefing, we want to make sure that you also are a champion for vaccinations for someone around you who has not gotten their vaccine yet. With that, I just want to also say thank you to our media partners. You have continued to cover this pandemic with graciousness and grace, and we just want to say thank you for jumping on alongside with us on a Saturday evening. And though it's dark outside and it's rainy and gloomy, we know that you're all sunny because you have continued to work with us throughout these months. And as Dr. Baird said, now it's going on, sounds like, feels like years. But thank you so much. Thank you, everybody, for joining us. And we will continue to update you as we need as we get more information about this situation, this matter, but also for additional updates for our pandemic. And with that, I'll turn it back to you, Julie, to close.
Thank you very much, Dr. Shaw. And this concludes our special Saturday weekend media availability.